Hello, my name is Dr. Chris Williams and I'm your host on Well Again. Well Again is your online health magazine program in which we explore fail-proof protocols and principles for regaining health and retaining health. You are welcome. All right, today we are discussing hypertension. I'm sure it's either you are dealing with hypertension, or you know somebody who is dealing with hypertension, or you know people who are dealing with hypertension. Hypertension is such a common disease around, in and around us. Okay, so what is hypertension? Hypertension is high blood pressure. When you see, we have a circulatory, humans and even animals have a system. One of the systems in the body is called the circulatory system. And the circulatory system, we have the heart. That's the circulatory system is made up of the heart. It's made of the blood vessels, the arteries that take blood away from it, and then the veins that bring blood back to the heart. Now, for the blood to get to the extremities, the heart has to pump blood. That's the work of the heart, to pump blood, just like a water pumping machine, so that blood will go from the heart. The oxygenated blood will go from the heart to the extremities. It has a particular pressure with which it should pump blood. However, when because of one or two things, the heart has to use extra pressure or extra force to pump the same number of blood or the same volume of blood that it has been pumping before now to the extremities. We say there's high blood pressure. I'll say that again. When the heart comes to have need to use extra pressure to pump the same volume of blood it had been pumping before, we say there's high blood pressure. Some people have come to see me, and some people have called in and say, they say I don't have hypertension, but they say my blood pressure is high. High blood pressure is same thing as hypertension. There are two types of high blood pressure. There's the primary high blood pressure and there's a secondary high blood pressure. Primary high blood pressure talks of blood pressure, high blood pressure that is not secondary to anything. Okay, it's basically lifestyle. There's another sub variety that we call the essential blood pressure. In essential blood pressure, even a child begins to have blood pressure and for no just cause. But that's not what we're talking about. There's primary high blood pressure. Primary high blood pressure, all people also call it the essential high blood pressure, is high blood pressure due to lifestyle changes. Okay, due to lifestyle changes, as the body texture and configuration is changing, if it is leading to high blood pressure, we say it is primary high blood pressure. So what are the causes of primary high blood pressure? Things like diets. We've spent a whole lot of time talking about diets that we're supposed to eat, the ones we're not supposed to eat. When people are abusing animal proteins, when people are abusing sweet things, even including sweet fruits, when people are abusing chemical substances that's putting chemical seasonings inside soup, those kinds of things lead to high blood pressure. Also, use of flours and processed foods, processed carbohydrates and processed foods generally, including eating of preservatives in food, lead to high blood pressure. Okay, so food generally, sweet things, abuse of animal proteins, very important, use of caffeines and all that. Okay, so diet, stress, depression, obesity can also lead to primary high blood pressure. Stress can lead to it. Depression can lead to it. Cigarette smoking can lead to it. Also, alcohol abuse can lead to primary high blood pressure. Okay, when somebody also eats a lot of sodium in his food, High sodium diet can also lead to high blood pressure, especially if the sodium that's there, it's not the complete sodium, what we call the either the sea salt or the Himalayan salt. Okay, if it's just all these table salts that we have all around, eating a lot of it can lead to high blood pressure. Drug abuse of drugs, use of hard drugs, narcotics, can also lead to high blood pressure, because these things cause the blood vessels to constrict. They can lead to high blood pressure. Excessive use of stimulants like coffee and other things that stimulate us, I've talked about alcohol, can also lead to high blood pressure. Okay, I must not forget to say that family history, when people have a history of high blood pressure in their family, it means that they are more disposed to developing high blood pressure. Now, there's also secondary high blood pressure, and this is due to an underlying disease. There has been a disease there that is leading to high blood pressure. Okay, a disease like hormone abnormalities. Okay, if the person begins to have issues either with the adrenal gland or the thyroid, it can lead to high blood pressures. Hormonal abnormalities generally can lead to narrowing of the aorta. The aorta is one of the major vessels in the heart. Through blood is pumped out. If somehow or the other the aorta is narrowed, is constricted, it can lead to high blood pressure. That's secondary high blood pressure. Okay, constricted blood vessels also, for one reason or the other, the blood vessels in the body begin to constrict, can lead to high blood pressure. And then deposition of fatty plaques along the blood, the arteries and the arterioles. We call it atherosclerosis and atherosclerosis. Atherosclerosis and atherosclerosis. Okay, this can lead to high blood pressure. Okay, kidney disorders also. When somebody is having a chronic kidney disease, poor kidney functioning can lead to high blood pressure. We have said obesity can lead to high blood pressure. Okay, diabetes can lead to it. Hyperthyroidism can also lead to it. When the thyroid gland is overstimulating, it can lead to high blood pressure. Adrenal tumors also, or damage to the adrenals due to one thing or the other, it can lead to high blood pressure. All these other ones, we say they are secondary high blood pressure because they are secondary to something. Now, your normal blood pressure should be anywhere less than 120/80 mm per mercury. Normal blood pressure is anywhere from 120/80 down. Okay, so let's say from like 90 or 80 to for some people, 90 to 120/70 to 90, 70 to 90, 90 to 120/70 to 90 is normal blood pressure for a normal adult. Now, when the blood pressure has reached between 120 and 139, that's the systolic, the one on top, 120/139 over 80 to 89 or 80 to 95, we say the person is on the borderline. Okay, on the borderline. If your blood pressure is between 120 to 140 and then between 80 and 90 or 95 thereabout, we say you are on the borderline. If your blood pressure is 140, above 140, between 140 to 159, and then above 95 to 99, we say you have mild high blood pressure or stage 1 high blood pressure. Okay, that is 140 to 159 over 95 to 99. Okay, we say the person has mild high blood pressure or stage 1 high blood pressure. Now, stage 2 high blood pressure is anything beyond 160/100. If somebody has 160/100 of high blood pressure and beyond, it is stage 2, it is moderate, and it is something to worry about. If the blood pressure is 180 and above over 110, That's severe high blood pressure, and that's something to worry about. Now, what are the complications of high blood pressure? Several of them. Because the heart is pumping with force, is overworking literally, it can lead to heart diseases. It can lead to a thickening of the heart muscles, left ventricular heart failure, hypertrophy, or if you like, in medicine we call it cardiomyopathies, problems or diseases of the muscles of the heart. Okay, so it can lead to left ventricular hypertrophy or left ventricular heart failure. We say that is heart failure. It can also lead to heart attack or myocardial infarctions. In other words, one of the blood vessels supplying blood to the heart can burst or can be blocked, and it will lead to a myocardial infarction, or what we call popularly called heart attacks. Other things, complications that can arise from prolonged untreated hypertension are things like kidney failure or what we call nephropathy. The person begins to have problems with their kidneys. Or neuropathy. Neuropathy is common. You feel tingling and peppery sensations in your legs, in your hands, and sometimes it's all over the body. It looks as if they poured pepper on the person. Somebody called me, I think yesterday, and they said literally he has to station the fan on his leg in order to be able to sleep. That's a classical description of neuropathy. Hypertension can cause it. Diabetes can cause that kind of thing. It can high blood pressure untreated can also lead to retinopathy. That is, there's damage of the retina, and the person will begin to have problems with seeing. It first starts with blurring of the vision, and then if unattended to, it can lead to blindness proper. Stroke, and then micro infarctions of the brain that can lead to forgetfulness, memory loss, amnesia, and all that are also complications of high blood pressure. Now, what should you avoid? That's what we start from. You remember, we're always looking at diets, herbs, and supplements. What should you do without? Number one, animal proteins. Remove animal proteins from your food as much as possible. Do with only fish, and the fish should not be too much. Don't abuse animal proteins. Animal proteins destroy our body more than they help the body. Somebody says, where will I get proteins from? You get proteins from plants, from vegetables, from millet, from beans, from legumes, okay, from maize, from guinea corn, from oats. You get protein from all that. The protein in animal proteins is too much, so you need to avoid animal proteins and animal fats if you are battling hypertension. You also need to remove salt and sugar or sweet things from your food, whether it is natural sugar or artificial sweeteners. You need to remove them from your food. And if you must use salt in your food, it's difficult to eat food without salt. Use it very little and make sure it's Himalayan salt. That's more complete salt. The normal salt, table salt that people eat, contains just sodium and chloride, but Himalayan salt contains sodium and chloride plus 89 other minerals. They help to balance the sodium. Very important. Remove things like cheese from your food, chocolate, ice creams, yogurts. Remove them from your food. Disease from alcohol and caffeine, very important, and tobacco. Okay, and then stop using additives in your food. All these chemical seasonings, go for natural seasonings. They really do help you. Stop taking carbonated drinks, very important. And then avoid foods that contain a lot of tyramine and thyroxine. What are those foods? Bananas. Okay, avoid bananas, avoid almonds. Okay, I have recommended avocado for people a lot, but when you are dealing with hypertension, you need to remove avocado from your from your food. Okay, stop using meat tenderizers. Okay, stay away from sausages and foods that are generally high in protein. Stay away from them. All right, so also avoid artificial sweeteners. We've talked about it. And then avoid the use of over-the-counter drugs that are used for allergies. We call them antihistamines, Piriton, Phenergan, and all that. If they are not recommended by doctors, don't use them. They can tend to worsen hypertension. and then deal with overweight. Obesity is a major cause of hypertension. If you're battling hypertension, you must work on your weight. So what are the things to do? All right, regular fasting, detox programs is important. Go on vegetables alone for like 3 days in a month. Vegetables alone, you don't take any cooked food. It really does help. And then reduce your eating to like twice a day. Eat your first meal around 10 a.m. and then another meal by 7 p.m. Make sure they are not big, plenty of foods, and then they are mostly plant-based foods. Very, very important. I forgot to say, remove flours and refined carbohydrates from food. Stay with oats, millet, guinea corn. Stay with all that, grains generally. Okay, drinking also vegetable juices helps a lot. Vegetables like beetroots, carrots, cranberry, okay, celery, beetroot. Drinking this helps hypertension a whole lot. Use little or no salt, okay, and make sure it is Himalayan salt. Eat high fiber diets. High fiber diets help a whole lot. Okay, LD pap will supply you high fiber diets. Okay, and then I've said eat a lot of vegetables, very important, and then fruits that are not sweet, you can also eat them. The next thing I want to say is very important. Take 2 tablespoons daily of flaxseed oil. 2 tablespoons daily of flaxseed, it helps you. Be involved in exercise, walk at least 45 to 90 minutes every day. The regular walk, normal walk, and then if it's brisk walk, it also is good. Get enough sleep, avoid stress, deal with stress one way or the other, and then check your blood pressure regularly, very important. Okay, and then if you are taking supplements, don't take any supplements that contain thyroxine, okay, and also phenylalanine. Very, very important. Now, what are the supplements that you can use? So you need to be on supplements that supply you magnesium and potassium. Magnesium, potassium, calcium, mag pot. I've seen some of those things. Okay, calcium, magnesium, potassium, because these 3 work together. They work on the walls of the arteries. They soften it. You know, we talked about the thickening of the arterial walls. They soften it. Okay, ubiquin also is very good. It's good for your heart. It's good for the functioning of your mitochondria. You need to be on essential fatty acids. Fish oil is very good. It can be shark oil or krill oil. It's very good. You get essential fatty acids from like blackcurrant seed oil, flax oil, olive oil, primrose oil. These are examples of oils that supply you with essential fatty acids. Okay, garlic and ginger are very useful if you are drinking them in the natural treatment of high blood pressure. There's other supplements like L-arginine, L-carnitine, L-glutamine, L-glutamic acid, L-arginine, L-carnitine, L-glutamic acid, L-glutamine. These help to remove the plaques that are blocking your blood vessels, so they help to reduce the thickening of the blood vessels, which we call atherosclerosis and arteriosclerosis. Other supplements like selenium, vitamin E, ascorbic acid about 6 grams daily, okay, and then lecithin granules. Lecithin helps to emulsify fats and improve liver function and also reduce blood pressure. Other supplements you can be on are zinc, proteolytic acid, vitamin B complex, very important, B6, and then some herbs that can help you are hops, valerian, mistletoe. Please avoid licorice. Licorice is a herb and it's very good, but don't take it if you are hypertensive. It worsens high blood pressure. And then also herbs like chamomile, like hops, like passion flower, they help to reduce the stress from the body. There are books. We have several books several books, very good books. We have Reversing Diabetes Naturally. It's a very good book, and it's a book you want to order for Reversing Diabetes Naturally. Okay, we also have particular concerning this topic, Reversing Hypertension and Cardiovascular Diseases Naturally. It's very good. Reversing Hypertension and Cardiovascular Diseases Naturally. What I've said here in a few minutes, you can learn more there. Reversing Depression Naturally is very good. And then we have our flagship, Sickness Free, Fail-Proof Protocol for Regaining and Retaining Health. You can order these books. Just call us, okay, get across to us. Do not forget, these things we have said here are not prescriptions. They are for information purposes. It's so very important you understand that. Before you take any supplements, make sure you talk to your doctor. And then do not forget to help us subscribe, so that when new videos are done, you will get them. Also, help us turn on your notification links, so that when new videos come out, you get them also. Help us share to family and friends, and let's see how far we can go in trying to allay disease from our world. Thank you for watching. This is Dr. Chris Williams once again, and thank you for watching well again. Bye bye till I come your way again next time. Bye.